Yeah, let's welcome Jonatan Haile with the talk, Why Care to Translate?
So, for those who don't know me yet, my name is Jonatan Haile, or Jonatan Haile in Swedish, and it's the second time I'm here in the Polyglot gathering. I'm really happy to be here again. And well, about me, well, I am a medical doctor and a polyglot. The topic of my presentation is why care to translate, and the reason to why I chose to call it like this will make more sense in the end of the presentation, and I'm sure that you will care more about it in the end. Okay. So the whole theme of this presentation is about language barriers in healthcare. So I'm going to talk about what it involves and what challenges one might face as a patient and as a doctor. And then I'm going to talk about different ways to overcome these language barriers, namely by usage of interpreters, especially medical interpreters, the situation about that in Sweden, and other ways to overcome the language barriers in a more improvised way. And then we're going to show you some funny examples of where machine translation might go wrong. Then we're going to enter the world of care to translate, and we're going to end up with a conclusion. But first, I'm going to ask you some questions to know more about you. And I want you to raise your hand if you agree with this question, what I've asked. So the first question is, has any of you been in a situation where language barriers made you feel lost? Please raise your hand. Quite a lot, yeah. Anyone, have you or any of your friends or relatives been hospitalized in a foreign country? Yeah, also quite a lot of. Anybody here working as interpreter or medical interpreter maybe? Okay. Has anybody interpreted in a hospital setting to a friend or a relative? Okay, same person here. Anybody working in healthcare here? Nobody, okay. So if I would answer these questions myself, yes, the first thing came up with me to my when I heard about the language barriers make me feel lost. It was when I would travel to Beijing with my friend. We wanted to go to the Great Wall, and we applied for this group, like tour guided. And when we arrived to the metro station, it was all canceled, so we were there alone. But we still wanted to go to the Great Wall, so we got a piece of paper when it's written in Mandarin Chinese characters of the bus stop that we had to go off. So we were sitting at a bus and looking at the bus screen and our paper and trying to compare the Mandarin characters that none of us spoke. That was quite stressful. What did we talk about more? Yes, if I've been a patient in a foreign country, yes. I used to live in Hungary for 6 years, and then I remember the episode when I went to a doctor and he said something quite rude about me to the nurse, and he didn't expect me to understand it, so but I told him, like, yeah, I understand what you're saying. I said it in Hungarian, and he was like, okay. I am not a medical interpreter, but I have been interpreting in various occasions as a doctor, colleague to different patients in different occasions, yeah. And yeah, I'm working as a medical doctor. I work in healthcare. So this is a picture I start with, and I think this also agrees with this saying that a picture is worth more than 1,000 words, because I can see many kind of barriers in this picture. Maybe you also can imagine here that's not only about language barriers. So language barriers in healthcare, what are the possible consequences and risks of that? The first thing I brought here is misdiagnoses. And what we know is that about 70% around that of the medical clues that we get as doctors to find a diagnosis is based upon the patient history, the anamnesis. It all quite makes sense that if you don't understand the patient and the language, you don't get correct information, and there's higher risk of misdiagnosis. Another thing is that is also proven in a study was showing in the US, where they looked at patients with limited English proficiency, shortened LEP, and they looked at the patients in this who never got any medical interpreter, either when they were admitted or discharged, and compared to those who had a medical interpreter during the stay. And what they saw that those who never got a medical interpreter on average stayed 1 or 1.5 days longer at the hospital. They also saw that the same group of patients had an increased readmission rate within 1 month. So the higher amount of these patients who had to come back and were hospitalized again. And those two things together will obviously increase the costs, which I will come back to later. Another thing that possible consequences of language barriers in healthcare is, which is more related to the patient itself, is decreased patient compliance, which is defined as how well the patient adheres to the therapy. For example, the doctor prescribes a medication and how well the patient would maybe follow this prescribed medication. And we have another example of this, and this was also another study made in the US. This time it was with a patient with diabetes and who also had limited English proficiency, and these were all from Latin America, had Spanish as a native language. And here they looked at patients who went to their GP, and one group had a GP whose native language was Spanish, so they were speaking the same language. And this is called a language concordance, where both patient and the doctor has the same native language. And the other group of patients had a doctor whose native language was not Spanish. And what they did is that they saw for an amount of years, they compared to whenever the doctor, they changed doctor, maybe the doctor left or somewhere, so if the doctor was not language concordant, but language discordant, as speaking English, they follow, they tracked it and see how well it affects the patient compliance. And what they saw is that when you were a patient who had switched from a language discordant to a language concordant doctor, there was a higher difference in the patient compliance. That is, how well they were taking the medications, and also how amount of patient who had satisfying blood glucose levels. And this made me think that maybe it's not only about words that we're translating, but there's other things when there are two people interacting with each other without the third person. There can be many factors to this, but the biggest impact was when you switched from patient speaking to in your own language. So, and then we go to interpreters, and I think that most of you here knows the difference between an interpreter and translator, right? So the interpreter is using the spoken word, and the translator using the written word. So we're talking about the spoken word here. And I looked at the situation of interpreters in Sweden, and it's quite hard to find out how many exact interpreters we have, because it depends on what qualification they have. But in Sweden, it is regulated somehow by Kammarkollegiet, which is an institution that one of their tasks is to be a national director of qualified interpreters. In Sweden, if you want to work as interpreter, you first do about a year of training to be a trained interpreter, and then you can start work as interpreter, but after that you can go to another exam and become authorized interpreter. And after that you could choose to specialize into medical or legal interpreters. And I actually entered the internet site of this Kammarkollegiet, and you can see actually the actual numbers of people, interpreters we have. So there were 1,037 authorized interpreters some days ago when I checked, and only 198 medical interpreters. And this is not only the amount of people, but if you have one person who is interpreting, like a specialized interpreter medical, in two languages, it becomes two. And also, there were no specialized medical interpreters in languages such as Tigrinya, Dari, Somali, and Urdu, which are languages that are quite often used in interpreting situations at the hospital. I will also come back to that later on. And then if you don't have any interpreter, medical interpreter there, what do you use then? Well, ad hoc interpreters. These are not professional interpreters. It might be the wife or the husband of the patient, and even in some occasions their children interpreting, which is very problematic in many ways, as children should not be working as interpreters. They might not understand grasp the whole situation, and maybe not do the correct translations also. It might also be just another patient sitting in the waiting room, being from the same country, and saying, well, I speak the same language. Well, the problem here, apart from not being a professional interpreter, is the patient confidentiality is broken in their case also, and many other problems that. And if you don't have that, you might have healthcare workers who speak many languages, such as me. So I have been in these situations where colleagues asked me if I could speak to patients in some language, and he wanted a quick help. Can you help me here? I mean, some language of Russian have been, I remember when I was in the infectology clinic for 3 months, and there were a lot of patients from different countries, and then when some days I had 3 different languages that I interpreted. It was more giving information, not a very deep talk with the patient, but still, yeah. And if you cannot have any interpreters, you start to use body language, right? So you can come quite far with that in certain situations, although that's not the best way to, you can quickly show that pain or like point at your body parts or whatever. And as you all know, a smile has no language barriers, and this is a proof of that. These are my 2 nephews, Axel and Lucas, 4 and 2 years old, and the one to the left is 4-year-old, already speaks English and Swedish, so he might be a future polyglot coming to these events in the future. Watch out for him. Yeah, so machine translation, everybody know what this is. Yeah, so it's Google Translate. And I have some examples of what might be funny examples of translation that not so usable of this translation. This is an example of Google translation gone wrong. Here we have Swedish language. This is where you would say "krysta inte nu." It's you would say that to a patient who is giving birth at the obstetrics, and you may want her to, don't push now, but they were written here, don't cry now, which is not really what you want to tell them to do. So it's not really, and they have German, a lot of German speakers here. This is also a good example of trying to translate the language to another with different, yeah, they have a lot of words for why in German, it looks like. The same with Polish here. A lot of different ways to say "to," I can see. So yeah, I'm not going to say it out here. Can anyone guess which this language is? Correctly, Tigrinya. So I spoke to my dad about it, and he helped me to pronounce this or say this word. So this is a sentence that you would say is "Kemliseka delio allo," which sounds similar to "Kemeliselka delio allo." And the one means do you need to vomit, and the other one needs does he want to answer you. And it certainly got this wrong, the Google Translator, so you can also imagine this situation trying to say to a patient. It doesn't really make sense, yeah? And here is Finnish, and Finnish speakers here, maybe, I don't know. Not. All right, so I can now pronounce it correctly. It's "yritä maata aloillasi." Here, the correct translation is "try to lie still, calmly," and here it says "try to land in your fields." I don't really know why that. Maybe because maa means country or land in Finnish, maybe. And here is another example who don't need to complicate things. This is actually true. It's from a Finnish hospital where it says different Finnish words like "sisätautien poliklinikka," which means like internal medicine clinic. And here is, instead of translated, it's just wrote the same in Swedish. The same in Swedish. It's quite funny. So I think maybe the reason to why they had that is that area they need to have both Finnish and Swedish there, so just quite lazy and just put the same in Swedish. Yeah. So back to the problem. The problem is that we have few qualified medical interpreters. In some language, you don't even have any specialized medical interpreters. And we saw example of machine translation where they're incorrect and unsafe, which is not what we really want in a hospital setting. So, once upon a time, there was a medical student in Stockholm who went out to the hospital for the practice and met a patient. They understood that, well, I cannot really communicate with the patient. They don't understand Swedish. They have limited Swedish proficiency. So he went back, and with his fellow student, they started to have like an evening course where they tried to learn some sentences in different languages, how to speak to patients. And they continued with this for some years, and then it ended up in an app, and they started a company. And here in this app, they have medically verified translations in more than 40 languages, and the app is called Care to Translate. It comes back to that. So what's good about this is that these translations are actually verified by healthcare workers who are native speakers in those languages. So it's not just one person who speaks 40 languages, but they have like people from different countries, which makes it more natural for the patient to understand. And it can be used at a smartphone or device. So it's used as to give information to the patient, give instructions, and also to ask questions, which is answered by yes and no, like nodding, shaking their head like that. And you can press on the different sentences, and then you can hear the sounds, and you can show. And because there are so many situations where you might not be able to call an interpreter or don't have the situation, and many times there are standardized questions that you would ask the patient in a certain setting. For example, in radiology, you would ask the patient if they have allergy, contrast allergy, or like that. But many times what happens in Sweden is that the interpreter comes in when the patient sees the doctor. But there's a lot of things coming before that. They meet the nurse, they meet different parts of the whole healthcare chain, which you don't have an interpreter. So this could be used to help this situation. So they have more than 40 languages right now, and these are the languages that is on the list. And you see those, I don't know if you can see this, but those in red, it's the same language that there is no specialized medical interpreters, so it can be used in those examples also. Yeah, so as a conclusion then, when I thought about this presentation about the topic and the care to translate, which I think is a good name of this app and this whole topic, as we've seen, it's rather costs more to not being able to communicate with the patient, and it's quite a hot topic today in Sweden. Since last year they changed the government, and they wanted to because the medical interpreters is paid by the state, subsidized, but they want to take away this, and maybe they propose that if a person has lived in Sweden for more than 2 or 3 years, they should pay for the interpreters by themselves, which I think is highly problematic, because if they're sick, they should be getting the equal health care. And if this is the reason to save money, actually they're proven that it's the opposite, that we actually don't save money for that. And as I told before, with the prolonged hospital stay and readmissions and all these examples. So it's a balance between, do we care, how much do you care about it, and how much does it cost, as it many times is. I'm going to end up with a comic strip here. What I thought about quite a lot. So it says here, sprechen Sie Deutsch. Sie Deutsch, okay, great, thank you. Habla español, and there's a man talking to a duck and doesn't get any answer. He says, try different languages, and in the end he just said the quack, and then they start to talk about. And this is like example of, like the Nelson Mandela says, if you talk to a person in a language he or she knows, it goes to the head, but if you talk to the native language, at the patient to the native language, you go to the heart of the patient. And I think this shows. And there's a quite little bit like we are doing here at the Polyglot gathering, looking at each other. Which language do you take? And it opens like a new world when you speak to a person in the native language, I think. Yeah, so this is the end. And spasiba, tack, gracias, yaqanyele, thank you, köszönöm, shukran, and kwak. Thank you. So the questions here, is this app language to Swedish and Swedish to language, or can it be used other language? Yes, if I understand it, I was in Hungary some days before I came here to visit my friends, and I showed them, they entered this app, and it was all written in Hungarian, so you can use it in different countries. It comes up with different language. You can choose which language it will be written, the questions. I heard that in Sweden, sign language is recognized as a minority language. How deaf people are protected in medical situations? Well, that's a good question. I don't really have the correct answer of this, like, because I'm more focused about the language that we are speaking. But in that case, I guess there would be interpreter too, like for deaf people. Although I don't know like how that. I guess it's the same situation as with the spoken. Could you talk about legal issues with interpreting errors, both with human interpreters and using this app? Okay. Well, the reason it's very good questions. I don't really have much information about the exact legal issues about this translation, but the good thing about this app is that it's actually verified by healthcare workers who are native in these languages. So hopefully it will be the same as when you speak to a doctor or a nurse who has that language in their own language. So, yeah. Do you give a specialization in medicine? So yeah, I'm a doctor in internal medicine. So it's I work both in the emergency and in the wards. So we have patients with different diseases that are not surgically, but a lot of them have like metabolic diseases, stroke, and cardiac diseases. Yeah. Also good for psychiatry. That's actually a good question. I had actually a situation like that. I forgot to tell you earlier. When I was working there in the ER, and there was a patient who was hospitalized in internal medicine and then had a psychosis or had to send to the psychiatry clinic. And then the wife of the patient just arrived and saw me there, and she just started to talk Arabic to me. And I was, okay, yeah, I'll speak some... أنا بتكلم مصري أو شوية بتكلم, and then you understood that she was quite worried about her husband, what happened, and he said he's not a bad person, he never hits me, he never does anything wrong. The concept of psychiatry maybe for her was completely different than we understood. Some countries and cultures might be taboo, etc. And I tried to explain to her in some ways, and then I just used this app, and there is a certain topic called psychiatry, and I used one of the sentences, and I really could see in her face that it's actually calmed down a little bit. So actually words do matter, it's true. Are there any plans to roll out this app to other countries? Well, it's mostly used in Sweden, but now also started use in Norway. So that's why they also have in different Sami languages that they wanted to have in different Northern Sami and different Sami dialects. So yes, so it's getting more and more, but mostly in Scandinavia from now on. Thank you, you're the best. Thank you. Did you go to medical school in Hungary? Yeah, so I studied in Hungary. I had a talk last year about that. I was living in Hungary, about labeling. So yeah, I did the whole medical school there. That's why I also speak Hungarian. But it was in English we studied, but I learned Hungarian. What is, in your experience, the most overlooked linguistic minorities in the medical field? Well, from what I saw here, when I looked at interpreters, that there were no really specialized medical interpreters in those languages like Tigrinya, Dari, Somali. And since there are so many speakers of that language, I think that can be a proof that it's overlooked. And then what's the reason to why they not be specialized medical translators? I think it might be lack of incentives, because I know that if you're a legal translator, interpreter, the wages are, salaries are much higher. And in the end, that might have a big factor of it, so I don't know. Was Dr. House good at languages? I don't know about that. Can a doctor also be a medical interpreter? I think yes, because what I remember, the best interpreters that I have met are the ones that afterwards I asked them what they were working before, and they said, I was working as a nurse. So actually it's not all about the words itself, but you understand the context, which is quite a big difference if you have an experience in the field. So I think so too, like if you've been working in healthcare. Do you know if the app already is certified by a governmental body? I don't know that. I cannot know answer to that. Do you think it's still worth it to become a medical interpreter if such apps like Care to Translate are emerging? Yes, I still think so, because this is just a way to give information to the patient, ask yes and no questions. So it's not to saying that we don't need interpreter. We still need them. And this is just, it's not a real dialogue explanations, more to give instructions and trying to come yes and no answer to the whole situation. So I think it's just helping to overcome the language barriers in other ways. Let's see. You speak quite a few languages, so do some other medical personnel ask you for your assistance often? Well, that happens. That happens sometimes. And I like it as a polyglot. I enjoy being able to speak in those languages, although I know my limits too. I cannot do too difficult things that are not really what I have experience or knowledge of. All right. Well, thank you very much. Bye.